Hey, welcome to my controversial topics presentation on home birthing. We're going to be discussing is home birthing safe and medically appropriate? To introduce this topic, home birthing, there is much controversy on where and how someone should deliver their baby. There's lots of different recommendations and opinions about this, but the two main competing perspectives are home births and hospital births. And the debate is if home births are safe or if that they're not. These two perspectives are what we're going to be talking about today. So, first off, to define what is home birthing. A home birth can be defined as planned childbirth that takes place within a private residence rather than a clinical setting, and it is typically attended by at least one healthcare professional. Okay, our first side of the debate is that home birthing is safe. These people who are proponents of this believe that their home births are safe and sometimes even safer than hospital births, and they advocate for this more personalized and private labor experience. They're typically proponents of more holistic methods and believe overall that this is the best thing for them and their baby. The other side of the debate is that home birthing is not safe and that it is not medically appropriate. These who believe that argue against home births, believing that they pose a risk to the mom and baby and that it's even irresponsible to have an at-home birth. These people believe in a more traditional environment, which is a hospital or clinical setting, and believe that that is the safest option for giving birth. This is a graph I made that examines home births compared to hospital births within recent years. So, as we can see, home births have had an increase in the amount of people who choose to do home births within recent years, reaching 25K, whereas hospital births have remained between 3 and 4 million people choosing to give birth in a hospital within recent years. So, obviously, the more favored way to deliver is in a hospital setting by far. But it is important to note that home births have been increasing in their popularity. Okay, this slide is just to represent that there are so many different opinions out there and that it is important to choose as an individual what is best for you and for your family. And that can be for a variety of different reasons. So this slide just kind of shows how there's lots of different opinions out there, but it is important for you to make the most informed decision for you and your family. Okay, let's talk about pro home birth. Why are people choosing to give birth at home? Some key reasons include that home births have a natural birth proponent. Usually, these people are doing unmedicated birth and really want to fully experience what a natural birth feels like. These individuals may have had negative hospital experiences. COVID-19 definitely led to an uptake of at home births because people were scared of the hospital. A lot of people want to avoid unnecessary medical intervention, and they have a desire for privacy and overall control of their environment that you would not get in a clinical setting. Some benefits to having a home birth is that research has shown that there is a reduced maternal morbidity rate when giving a birth at home. This is because women tend to experience fewer postpartum hemorrhaging. There's lower medical intervention, which means that usually you're not getting induced and there's not C-sections and things like that happening during the birthing process, keeping it natural. And overall, women have a high satisfaction rate when they give birth at home because they felt like they were in control of their experience and they got to have a lot of comfort and just determine their environment as opposed to a clinical setting birth. Some other benefits, as I just mentioned, control the birthing process. They get to try different pain management strategies as far as position and overall just their environment is up to them, which is really a privilege that you don't get in a hospital. Overall, there's lower risk of infection having your birth at home for both mom and baby, and it is a lower cost. And this is a big driving point for a lot of people to give birth at home, is that there are fewer medical bills and insurance fees that make home birth a lot less expensive than giving birth in a hospital. A big risk that you run when giving a home birth is that there's definitely some conflicting research about fetal outcomes when given birth at home. Some data notes that there's no difference, but there's definitely a lot of data out there that promotes adverse infant outcomes while giving birth at home. So you could be potentially putting your infant at risk. This is a warning that all the research collectively agrees that if you are at a high risk for a high risk pregnancy. This could include giving birth to multiple babies, needing to have a C-section or history of C-section, the position of the baby, or if you yourself has a pre-existing medical condition, that you should give birth in a hospital that has a highly trained staff that can handle your special circumstances. So this is just a disclaimer that I wanted to include for high-risk pregnancies. All right, let's move on to pro-hospital births. So why give birth in a hospital? This is definitely the more traditional view is to give birth in a clinical setting, and women tend to feel like this is the safest option because of their easy access to medical care. Some benefits to giving birth in a hospital are obviously that you have quick access to any kind of medical care you may need, whether that is with to do with the fetus or if you hemorrhage or an unexpected complication, you have what you need right at your fingertips. This tends to lead to a lot more improved outcomes for both mom and baby because it's a lot safer to give birth this way in case of an emergency. Additionally, there are some better pain management forms. You're able to have access to epidurals and different medications that would not be available elsewhere. Another benefit to having your birth in a hospital is that you have monitoring and diagnostic tools available to you that can prevent a problem, perhaps before it happens, or one that may go untreated. So if your baby's born with something, you may not be aware of it unless you have these kind of tools available to you, which are only in a hospital. Going along with that, hospitals have a neonatal intensive care unit, often referred to as the NICU. The NICU can provide advanced medical treatment in case your newborn is born in critical condition. If you give birth at home, you definitely wouldn't have access to care like this, and that could result in lower infant outcome. Overall, mothers tend to feel less anxious when they give birth in a hospital because they have that safety net around them, and this can lead to improved satisfaction. Some cons of giving birth in the hospital are, of course, that you could potentially be receiving medical intervention that may not be necessary. This could include inductions or a C-section. They could be breaking your water, things like that, that may not always be necessary and can lengthen the time of your recovery process. It's also just you're receiving a standardized protocol. You don't get to personalize this, and you definitely have less control and maybe even attention to you during this process. Another thing to note is that care definitely varies from hospital to hospital. So, inconsistent treatment can lead to inconsistent outcomes. So, you should definitely research what hospital you give birth to if this is your plan. My argument is that I argue for pro hospital births. Some of my reasoning is that hospital births are just safer. With less medical intervention at home, you are increasing your risk of potentially tripling your neonatal mortality rate. This American College of Obstetricians and Gynecologists, which is a really renowned source, straight out does not support home births. They believe that it is not safe. Other sources, like the Mayo Clinic, say that hospitals are the safest setting for delivery. Life-threatening problems can happen within an instant during labor and delivery. In those cases, you need to be at the hospital or your life could be at risk. Additionally, I have more research that confirms that home births can increase your risk 2 to 3 times higher when of a bad outcome for your infant when giving birth at home. And some other information is that there's a higher statistical probability of neonatal seizures and low APGAR scores, which is a test that they give you when your baby is born to test their needs when you're at the home compared to the hospital. Something to note is that some sources do promote home births in a high resource country like the United States when you are a low risk pregnancy, it is not your first baby, and you at least have one medical professional with you. So that's just something to know. My personal experience is that I've been a tech at Utah Valley Hospital and I've worked in the emergency department. And I've had the opportunity to witness a home birth gone wrong. We had a patient get rushed to us from an ambulance where she had something unexpected happen during her labor. And luckily, our staff at the ER was able to provide a good outcome for both of the mom and baby. But this is definitely not always the case. This experience just reaffirmed to me how dangerous labor can be, and something can go wrong within an instant. And if you are not close or have easy access to medical care, there can be very bad outcomes. I believe that if you are choosing to give birth at home, you should at least have a route that is quick and planned out. A lot of people call it the hospital transfer plan in case of an emergency. I argue that having a hospital birth can limit unexpected stress that could occur if there is an issue, or just knowing that you have the care you need if something goes wrong can really ensure the best chance of safety for both mom and baby during the labor. This slide just kind of shows some of the main points that we talked about today. In conclusion, I do argue that hospital births are the safest option, but I want to re-emphasize that labor is an individual and deeply personal experience. Choosing to give birth can look different for everyone, and there's lots of research available that should be explored before you make a decision on where to give birth and what is best for you and your family. Here are my references. Thank you.